Welcome back. This morning we're drawing comparison between the tackling of tuberculosis, this is World TB Day, and COVID-19 that is ravaging the world over. And with me for that discussion are Dr. Chakaya Jeremiah, who's a chest physician and TB expert, as well as Dr. Bernard Langat of Amred Health Africa. Gents, you have been giving us information on how we can draw comparison and learn from the various situations, but there is that issue that we talked about earlier on, where one would keep thinking this is someone else's problem, so I'm not going to think of it as I could possibly have it. And this is why we have seen some of these leaders going around business as usual, attending mass, funerals. I mean, as we keep pushing the problem further away, while we're possibly, let's say I have the COVID-19 virus, but I keep telling myself, it's someone else's problem. What's happening in my body? Or even with tuberculosis, if I might have it, but I'm thinking that this is not my issue, this is something that happens to everyone else. What happens, and how is it more dangerous to me and the people around me?
Let me start with the tuberculosis, because it's the one that I'm a lot more familiar with, because I've treated many patients and I've been in that, if you would call it, the war trench for a long time.
Yes.
The key to reducing the risk of bad outcomes from tuberculosis is early diagnosis.
Early diagnosis, yes.
If you're diagnosed early, you transmit your disease to fewer people. Your body is not as damaged as it could be, and therefore you've got a higher chance of curing, and curing with no further health consequences.
Okay.
If you delay, you have a very big risk of developing severe forms of the disease, and even after you are cured of the disease from a bacteria point of view, you can end up with a long problem. It could be the beginning of a long period of ill health, because you have damaged your lung, for example, what we call post-TB chronic lung disease.
Okay.
COVID-19 will be the same. There is actually a public health responsibility that if you think you may have been exposed, you do not want to pass it on to other people. So get tested. The earlier you get tested and the earlier you go on quarantine, the fewer people you are likely to infect.
Yes.
Today we know that with COVID-19, the global average is that every infected person will infect another 2.2 people.
Wow.
And in places where there are no control measures, you could infect up to 4 people. Now, if you want to control that disease, and you have a responsibility as an individual to make sure you don't pass it on. The earlier you test, the less risk you have of transmitting to other people, the higher your chance of getting appropriate medical care when the disease sets in. And all these things are all important, and they could save lives.
Okay. Now, you have worked with communities, and you understand how their responsibility is talking about. What can communities do without getting a bit too, I don't want to racist, or, being too mean to people? Because the other day we saw a woman who had asthma, but then she got called out and people are videotaping. So what can communities actively do to ensure that they are protecting themselves but not segregating members of the community?
Well, at the personal level, I mean, and you need to first protect yourself, and we have talked about making sure that you limit exposure. So, and the government has said that stay at home, work from home.
Has there been things that I've done with TB that could actually be implemented in this respect?
We once a diagnosed case is done, we normally we no longer isolate in hospitals, and we treat them at home.
Okay.
Yeah. So and because the numbers was huge and isolation facilities was not adequate.
Okay.
So. But that is when you have a disease. But for COVID, first thing is don't get exposed. Stay at home. Avoid unnecessary movement. If you work from home, that is what industries and have been advised. The second part of it is protect others. So if you suspect that you could have been exposed, or you have traveled abroad, or you have the symptoms, then self-quarantine yourself.
For sure, yeah.
Use a mask. I think there's a misconception that mask is actually meant for a patient, the surgical mask.
Yeah.
It is for you to protect others. So protect your family, protect the community by observing cough etiquette.
Yes.
You know, not using tissue. Generally, even say if you don't have a tissue, you can just cover your mouth
with your, yeah.
So hand washing.
The very basics that we've
The very
been told
basic,
over
the
and
very
over
basic
again.
thing. And if you can then reach out to authorities if the condition then worsens.
Yeah.
And we encourage that you reach out to authorities. You don't have to travel around. They can come and collect samples from you. Yes, especially if you meet a criteria that probably you have been exposed
to that.
So,
to the virus.
So, but I think the messaging should be around everybody is at a risk. You know, it's not sitting down and imagining that you are not at a risk is a mistake. And that is what Dr. Chagai was saying, that we all think that is not me. It's about the elderly. It is remote. I'm in the village, so it doesn't reach my places. I mean, we are in a global village. People are moving around. So really, I think that idea that everybody must believe and agree that they are at a likely risk of getting it must sink to the population. And when government tells you to stay or we stay at home, it's not belittling. And because I see a lot of movement where we are saying, you know, it's like we are making a joke out of it.
Yes,
yeah,
not taking it quite as seriously as we should.
Countries are learning the bitter lesson. I think the advantage is that it is coming to Africa when we have already seen what is happening in Italy. I think you are discussing with Dr. Chagai that people move from the cities to the rural areas, and the next thing is massive spread across the country. So we are learning from China, we are learning from Korea, South Korea, where there was massive screening.
Right.
So the reality is South Africa has just gone for a lockdown.
Yeah.
So if we keep on seeing it as if it's not serious, in another 1 or few days,
we'll be finding out for ourselves.
And it will be maybe late.
Yes.
And the consequences to economy and all of us is massive.
We've had enough cautionary tales to learn from, but as we conclude, could you tell us about how it's important to ensure that people with already existing conditions, TB and what have you, can be helped to keep up with their treatments? You know, despite the fact that we have corona, there are people who actually need to stick to their treatments. TB is said to be one of those that if you skip treatment, then it just goes back to square one. Tell us about that.
I think it's important for the Kenyan public to understand and for everyone to understand that even though we have this new thing that is difficult, and we are all thinking about new thing that is scaring all of us.
Yeah.
However, health problems have not gone away.
Right.
We still have diabetics, we still have hypertension, we still have people who suffer cancer, we still have people with TB.
Yes.
And all these fellows all these Kenyans need to be provided with the services that they need, and they need to continue in care. There will be other infections. There will be malaria. There will be other viral infections. There will be other pneumonias. I mean, it's important to know that not every pneumonia that you get is going to be a COVID pneumonia. So the health service has to continue providing care for those who have conditions other than COVID-19.
Right.
TB services must continue to run so that people do not interrupt treatment. HIV services must continue to run so that people do not interrupt their services. Like I said, COVID wave will probably go away. We don't know what damage it will have left by the time it goes away. But these are the problems that are there with us, and we do not want to create another mountain of problems because of how we handled these other services during this pandemic.
Right. And your message as we conclude on TB and the World TB Day?
So maybe just to add on what Dr. was saying is that for HIV patients, I think we have options where people can be given medication for many months.
Yes.
So and I think
so that they can,
so that they don't need to, especially if they are stable, they can also be delivered medication at home. So I think those are conversation and directive that has been provided that consider what we call differentiated care, that give medication for multiple months. Because, and if somebody has gone up country, they should be able to go to the nearest health facility and get the medication. So we don't need to interrupt. interrupting treatment for tuberculosis, you actually incubating and creating another problem of multi-drug resistance. So I think for my last message is that World Tuberculosis Day is a time that we create public awareness, but it's also a time to reflect and recommit ourselves that we are still missing cases. In Kenya, almost 40% of the TB cases are not diagnosed. And we must do all the efforts to make sure that we identify these missed cases so that we can stop the transmission. And it takes the efforts of the private sector, the community, and the government.
Okay, thank you very much. That has been Dr. Bernard Langat of Amref Health Kenya and Dr. Chakaya Jeremiah at Chest